Long Island Backstory with Chief Correspondent Gary Jacobs.
Good evening, everybody. I'm Gary Jacobs, and welcome to another edition of Long Island Backstory, where we're filming at the Alt Studios in Hauppauge, Long Island. Today, I'm honored to have the premier alienation expert, and as I used to say when I interviewed her before, the premier leading alienation expert in Long Island. Then I used to say the leading one in New York State. Then I used to say the United States, and now when I talk about her and I recommend her to people, I say she's the leading alienation expert in the world. And that's because she's written extensively about the subject. She's an author of a book, The Parental Alienation Syndrome, a family therapy and collaborative systems approach to amelioration. That's a mouthful, but this has been used many times. Her papers, her amicus briefs have been submitted worldwide and are widely accepted. Linda has over 40 years of education and clinical treatment experience with families. And as I said, she's really one of the world leaders in alienation. Her resume is huge, and I don't want to take so much time talking about it. So if anybody wants more information, all you have to do is Google Linda Gottlieb Alienation, and all of her papers will come up. So Linda, thank you for taking your time out of your schedule. I know you have a lot of cases that you're working on, and I appreciate you coming out this afternoon to be on the show.
Thank you for inviting me. I appreciate it.
The first thing I have, my question was, what is parental alienation? And when we were just in the lobby, you said, what are you going to ask? And I said, don't worry, you know everything, you testify. But you said one thing is, we don't use the word syndrome anymore, which I didn't know. I always say it's PAS, parental alienation syndrome. Tell me, why did you drop the word syndrome?
Well, I didn't personally do it. I would like to take credit for that. But
you said we.
There is, unfortunately, it's a tempest in a teapot, the controversy. There are a number of reasons that we now say parental alienation rather than parental alienation syndrome. First of all, a syndrome applies only to an individual. It cannot apply to a relationship. And we all know that parental alienation involves a child and two parents. So the DSM-5, the latest version of the Diagnostic and Statistical Manual of Mental Disorders, actually has a section on pages 715 through 719 where they talk about three different family dynamics that is very characteristic of the dynamic of parental alienation. One is child caught up in parental relationship distress. In fact, my colleague, William Burnett, a child psychiatrist, faculty emeritus at Vanderbilt University, actually wrote a 2015 article with two contributors to the DSM, and in that article they talk about parental alienation being one of the family dynamics that would fall into that clinical classification. There are two others: parent-child relationship problem, when a child develops unwarranted feelings of estrangement for a parent, meaning they reject that parent. And the last one is my personal favorite, psychological child abuse. In that clinical presentation, a parent has done something to undermine a child's psychological needs. And of course, we know that a child has a psychological need for both parents. So one of the examples of this is when the child is taught that the other parent denigrates the other parent will abandon them, harm them. So those are the three classifications that the DSM has chosen to use. So we go along with that. It just makes sense. It involves both parents rather than a syndrome which would just focus on the child. However, the 8 manifestations of an alienated child that were extensively written about and actually, first documented was by child psychiatrist Richard Gardner. These 8 manifestations are widely accepted in the scientific community, and they are accepted even by the community that initially took issue with using the word syndrome.
Just going back to the 3 things that were in the DSM-5, I've heard people refer to folia do. Is that What is that?
That is actually a diagnosis where it is a shared delusional disorder. It is determined that in severe cases, when a child becomes pathologically enmeshed with the alienating parent, that is a severe boundary violation by the parent of the child, where the parent virtually takes over the child's thinking and feeling and orchestrates their behavior to maltreat the other parent. So that is a classification that some people have used when they didn't, when the PAS was not accepted as a syndrome, and that really does happen. These children do develop a delusional thought system. You know, because of our long dependency period, the need for a parent is part of the instinct for survival. We need our parents. And so to reject a parent, the child really has to take extreme measures to concoct frivolous and absurd rationalizations for that parent. And eventually, that child will eventually believe that. I wrote an article, facetiously, metaphorically speaking, an alienated child could pass a lie detector test, and I really do believe it.
As can an alienating parent many times is a sociopath.
Well, yes, I think those are two different issues. In severe cases, the clinical literature widespread has found that severe alienators tend to exhibit severe psychopathology and one or more personality disorders, narcissistic, borderline, and antisocial. And these are very serious. They are not amenable to treatment. And
well, that's important that you said that, because a lot of people, they'll say, okay, well, now we know this person through a forensic evaluation has one of those three things. And they'll say, well, let's send them into therapy to see if we can stop it. But as you said, they're not amenable to it. And I think one of your colleagues that you work very closely with, Steve Miller, is on the same page with you that this is waste of time, because you're not going to change. I think, what did he say? There was something like, you can't talk somebody out of psychosis.
Right.
I think that's his,
right.
you know.
I think that traditional reunification therapy, where the therapist and the child, the therapist focuses on the relationship between the rejected or alienated parent and child, is meaningless too, which Dr. Miller says, because the child goes home to the alienating parent. And that is like giving antibiotics to a patient with an infection and then returning them to the germ-infested environment that had caused the infection. They're going to be reinfected, and of course the alienating environment is the germ-infested environment. So that is a real problem, and as a matter of fact, there is a 2013 book published by the American Bar Association, no less.
That scares me when you start with that, Linda.
Right. Like Clower and Rivlin, Children Held Hostage, Identifying Brainwashed Children, Presenting a Case, and Crafting Solutions. In their introduction, they state that we have found that traditional forms of reunification are of little, if any, benefit for this serious form of child abuse.
I couldn't agree more, and I think you couldn't agree more
right.
too, which is what we're going to get to a little bit later. I just want to backtrack a little bit, because you spent the first 10 minutes of the show talking about the DSM-5 and the different codes, and people watching it may say, why do you guys spend so much time on this? I want to talk about parental alienation, what it is and the causes. And that's because we're on Long Island backstory. People are going to be watching this all over the world. But on Long Island, when you go to court claiming parental alienation, you end up spending half the time testifying as to whether or not the psychological community at large even believes there's such a thing as parental
Correct.
alienation. And the first thing the idiot lawyer does is goes, well, it can't be because it's not in the DSM-5. And I've heard you testify and you bring up a number of other syndromes or psychological conditions that were not in it and now are, and they're widely accepted. So, but you have to get around, that's important to get around that, because here on Long Island, you get caught up in whether or not there is such thing as
right.
alienation.
Well, I have good news for the community. First of all, the DSM is such a flawed manual that the the National Institute of Mental Health withdrew support for it.
Wow, interesting.
Yeah, and in any case, they now, the insurance companies, which is what the manual was for, to codes to bill insurance companies. It wasn't any researched manual. They are actually requiring now that we use the ICD, which is the International Classification of Diseases. And the ICD-11 is going to be coming out, and thanks to the work of Bill Burnett, my colleague, who has inspired us all, we have all written to the ICD task force, and the words parental alienation will be in the ICD-11.
So that's going to shut off all these lawyers who are going into court saying, it's not in the DSM-5, it doesn't exist.
Right.
And I'm sure you have an answer for this where you could probably speak for a whole hour about that.
Well, you know, why get caught up on labels? A rose by any other name is still a rose. Now, in New York, there was a ruling called Young v. Young. And they determined that it's so detrimental to a child's emotional health and the best interest to be turned against a loving parent that it is grounds for reversal of custody. And actually, that's what the appellate Division 2, which is over Nassau and Suffolk County, as well as I think the 5 boroughs, they overturned the trial court ruling and determined that 4 children should go to their rejected parent, so that every state that I've been in has language on the books that talks about this family dynamic being destructive to children. So Shakespeare said it well, a rose by any other name. As my colleague Amy Baker says, I don't care if you call it meatballs and spaghetti. Right. It's the dynamic itself.
But that's why you need an expert, when you're going to court to discuss this, because I've seen other so-called experts. I just recently saw one testify and literally spent half the day arguing with the other attorney and the judge as to why doesn't the community recognize parental alienation. And I think they said, who cares what it is? Let's look at the results of what it is. Well, I used to say that this is similar to Stockholm Syndrome. What do you think about that? Because it's hard to, for the people watching, it's hard to even conceive. And actually, and I have to be honest, I'm a victim of alienation. And when I would tell people about it, they didn't believe it. And I have to say, before I experienced it, I knew somebody who was alienated. And I said, you know what? Maybe the guy in private is a real jerk and beats his kids, or he's abusive, because why would the kids be turned against? How could, the mother can't turn the kids against them? And I believed in my case, it wouldn't. So it is against common belief that a child would be turned against. So it is hard to believe, in fairness. It's hard to believe, but we know it exists.
Well, that's another reason that my professional friendship and relationship with Steve Miller was so important, because he teaches clinical reasoning and decision making. And we are very careful to apply the scientific method to analyzing these cases, because many states have the Daubertson standard, which requires really applying scientific method to the analysis of the evidence in a case. And one of the things that you have to do in the scientific method is to generate all plausible hypotheses. And that's where most of the non-specialists in alienation, the lawyers and even my colleagues in the mental health community, fall down. They don't generate the alternative hypothesis of brainwashing.
They become what do they call it, the aligned therapist, which is quite common?
Yes,
scary.
They become co-opted because these kids are so believable.
They are.
And in terms of, you brought up the Stockholm Syndrome, we now have research that shows that it only takes 3 consecutive weeks of interviewing a child and simply saying to them, last week when you went to the hospital, no, I didn't go to the hospital, it was total fabrication. By this strange researcher asking the question 3 weeks in a row, by the 3rd week, the overwhelming majority of these kids came in not only did they acknowledge going to the hospital, they had the whole story about why they went, who went with them. It is very easy.
And that's not a parent. Imagine
right. It is very.
Parent.
It's very easy to manipulate the mind.
Yeah.
And when you do throw in that these children are dependent upon that parent for love and nurturing and approval, it's not very hard at all.
And I think I don't know if it was a testimony or I saw you on video where you were trying to explain why people couldn't understand the alienation, and you talked about cognitive dissonance, and that explains why it's hard for people. It almost gives them an excuse to, say, look, you're making a mistake, Your Honor, attorneys. But let me tell you why. Explain the cognitive dissonance before we move on to more about alienation.
Well, we call it, these cases are counterintuitive.
Counterintuitive,
right? And that's another.
And I agree, it is.
Yeah, that's another area that Steve Miller, Amy Baker, Bill Burnett, and I, and a number of others in the field are educating the public about this. The closeness between the alienating parent and child looks like healthy bonding. When it is actually pathological enmeshment, a very severe psychiatric condition. When the child rejects the parent, the question should be automatically not that the child rejected a parent, but why the child rejected a parent, because the brainwashing can explain it. The other counterintuitive issues is that this needs to be an area of specialization. Not any mental health professional has the skills to assess this. You need specialized training in family dynamics, and then in the subspecialty of alienation. So there are many. Another one of my personal favorites: go slowly at reuniting the parent and child.
Which I read in your book, and you talked about when somebody goes overseas, when they're in the military and they come back after deployment of 6 months or a year. Do we say, listen, you haven't seen the kid for 6 months, let's go slowly, let's do a dinner, let's do it supervised? No, the guy didn't do anything wrong, he comes back, he loves his kids. They don't go slowly.
Right, very good analogy. We know that contact is the greatest antidote to the alienation. The faster, the better, the more intense, the better.
And we're going to talk about that. But one of the things that really, really bothers me, and I do a lot of advocacy work, as you know, here on Long Island, and just recently I was in 2 cases in Suffolk County where the same judge ostensibly blamed the alienated parent for the alienation. In one case they said, well, you know what, you get depressed. And when you're depressed, you're probably not so fun to be around. That explains to me the alienation. In the other case, the judge said, well, several years earlier, your children said you came home drunk one night and embarrassed them. So therefore, you're partially responsible. And I know in my case, my children's, one of their biggest reasons was that I forced them to go to Hawaii. And they didn't want to sit on the plane for that long. So what I say to people when they say this is, I would like you to tell the judge, so if a woman's walking down the street wearing a short skirt, dressed all sexy in high heel shoes, and she gets raped, do you say, well, you know what, maybe she's not 100% responsible, but she's 10%, because this is what this judge was trying to assign percentage of responsibility towards the alienated parent. And maybe you're 40% or 20%. Bullshit, you're 0%. Just like the woman who gets raped, there is zero excuse for a woman being raped.
Although we didn't always think that way.
Right, well, that's true too, right? We used to say a woman, sometimes they would say a woman asked for it 100 years, 70 years ago. Right. So nobody asked to be alienated. And you talked about your history in CPS and how foster care, when you would go to these children who were removed from the family, hopefully because of a valid reason, not false, that's another whole show, but hopefully for a good reason, they would all want to go back to their parents.
Yes, they do. First of all, to your comment about why it is assigned blame to the rejected or alienated parent, a lot of those cases are called hybrid cases. Both parents contributed. Hybrid cases are very rare. Very, very rare. That was the cognitive dissonance that I experienced because of those 3,000 foster children who were removed due to adjudicated abuse and neglect. I can't think of a case where they rejected a parent. They did want to be safe, but they wanted that contact. So that is true. But as Steve Miller also points out, that when the courts or even mental health professionals or the forensic evaluators say both parents contributed, they have failed to do a causal analysis. The dependent effect cannot precede a cause. And usually these parents are reacting to a terrible situation, being forced out of their homes due to false allegations of abuse and neglect, sometimes leaving only with the clothes on their back, having their beloved children reject them, make all kinds of horrible comments to them, going bankrupt just to have a relationship with their kids. People are going to react. That's called the fundamental attribution error. When you attribute as a characteristic or a dispositional quality to somebody when the cause is really situational.
Let's just say it wasn't true. How do you react?
But it's worse than that, because the evidence is always there in alienation cases if you have a specialist who knows what to look for. That's the problem.
So that's important. The evidence is always there.
Yeah, the evidence is there. And it's very clear. I mean, if you know what you're looking for, look, I've worked with 650 alienated children in direct practice. I've analyzed another 250 from case records. I could interview a child, and especially if the parent is present, probably in half an hour I can determine if the child is
truly alienated.
If the reasons are valid for rejecting that parent. There's so much to look for. It's what they say. They sound scripted. There is no affect that supports what they're describing. They'll sit there with a blank stare on the face, describing horrendous incidents of abuse. Their body language won't support it, and these kids are saying, "I'm terrified of him," and they are
as they're sitting next to them at the or in the same room sometimes, right?
As they're
Would
being
you talk about your abuser?
As they're being hostile and confrontational and going in the face of that
Aren't you afraid you're going to get home and get beat up if they're an abuser?
Well, if they're with the alienated parent, they're not going home with that child. But these are not how abused and neglected foster children behave.
You seem really abused children.
They've been obsequious. They're laid back. They want to make nice. Completely different. There is, it is the presentation between the two groups of kids are completely different. And if the parent is not placing the child at risk, there is absolutely no reason why they shouldn't have a meaningful relationship with that parent. You know, we send kids to therapy all the time because they're angry at peers, and we say that's not healthy. They shouldn't be walking away from peer relationships. Why are we letting them walk away from a relationship with a parent when we know that their long-term adjustment is dependent upon that relationship? It makes no sense to me at all.
Well, let's talk about that a little bit more, because one of the things that the courts here do, first of all, they like to let the clock tick, let the time go by, and I'm sure you've heard it because I've heard it way too many times from law guard. Just give the child some space. They'll come around. Maybe even they won't even come around until they're 20 years old, but let them come around. What kind of harmful effects does this have lifelong for somebody who's alienated?
Well, first of all, spontaneous reunifications are extremely rare. Very, very rare.
And Amy Baker, I did some, what was it? One of her books that she did was trying to find
Adult
out.
children of parental alienation.
And I think she tried to find out what we could do to get them back. And she really, if I recall, didn't really come up with one thing. There are different things that people said triggered it, but she couldn't give advice to say, hey, just do this and your kids are going to come back.
We don't know. I mean,
because people ask all the time, what do I do to get my kids back? And I don't know.
There is no information on that. But the long-term damage to these children are significant. We have something called adverse childhood experiences.
The ACE study.
The ACE studies. There are several of them, with the end population exceeding 9,000 and 10,000 people. And of family dysfunction, from adversarial divorce, situations like alienation, and the mental illness of a parent are 2 of the 7 ACE experiences. So we know that the long-term damage is very significant. We have a study by ANDA in which they say that these kids are subject to premature death as adults because of these experiences.
Well, because I think I was reading, because of health problems. They get heart problems,
heart
stress
cancer,
problems.
all sorts of
crazy.
things. Then there's the Spinazzola study, which says that psychological abuse, which this is at least as damaging, if not more so, than physical abuse and some sexual abuse. These are devastating studies. I mean, where they, what's the big deal, psychological abuse?
Right, I think that's what happens. It's downplayed. They don't even think of it. Like, could you go into court and comfortably tell a court, if that child is alienated, this is child abuse?
Yes, we say it all the time. You know, even those in the business who are not specialists in alienation and they don't know how to diagnose it, even they say when it exists, it's psychological child abuse of the worst kind. There is no dispute about that. When it exists, it is scientifically accepted to be serious child abuse. And one last study by Folletti and Anda et al. Said that the adverse childhood experiences cause a permanent restructuring of the brain for the worse, like lack of empathy. And if you don't have empathy, you don't have guilt. And if you don't have guilt, then that saves us from being
for the people who are watching, and
sociopaths.
hopefully the judges who are watching, this crap on Long Island where we let divorces go on for 2, 3, 4, 5, 10 years, when there's a problem, you got to hit it. You got to hit it hard right at the beginning. And we only have 2 minutes left, so I want to get into what can be done. Because when I go to court here and people fight, sometimes the judge will, I'll say, throw them a bone and go, well, you know what? They do need to have a relationship because that's important, and there's no proof. So go to therapy, therapeutic visitation, they'll call it. Go once a week for an hour, 45 minutes, to a therapeutic visitation. Or go to supervise. I say, don't do it. It is not going, Linda, and I'm sure you'll vouch for me, it is not going to work. And then it's worse because more time goes by, and what they do here is they let the clock tick, and they go, well, now the kid's 16, now the kid's 18, let's just let the kid come around, give them space. We now have something that's proven that actually works. And the last 2 minutes, we're going to talk about that, but then we're going to do a separate show on it. So tell us what does work.
All the research, there are 3 programs that have outcome data from a specialized treatment approach. One is Family Bridges.
Which is your program?
No, Family Bridges was Richard Warshak's program and Randy Rand's. And then there was Family Reflections in Canada from my colleague Kathleen Ray, who unfortunately had to close it down due to illness. And then I have Turning Points for Families, which I modeled on Family Bridges and Family Reflections. We have outcome data, and it shows, and Richard Warshak has just published another research study. He had done an initial one of 25 children, and I think the latest is of 80 or 90 children. And Kathleen Ray also published data, peer-reviewed. I have my data also, which I'm in the process of writing an article.
But it's hugely successful.
It is. They reconnected Turning Points for Families in 4 days, and it's no trick or magic. I'm working with the instinct for survival, and I'm also working with the no contact period with the alienating parent. So that influence is cut off. The child does not feel what APSAC, the American Professional Society on the Abuse of Children, labels as psychological child abuse, terrorizing the child, putting the child in a loyalty conflict where they are unnecessarily forced to choose one parent over the other. And so when there is that no contact period, which makes sense anyway, if it's child abuse, you do a removal anyway.
Right.
Those are the 2 criteria that have led to 100% success rate.
Great, unbelievable. So, as I said, we're out of time, Linda, and I had a lot of stuff to go over it. Please Google Linda Gottlieb, Gottlieb. Put in Alienation. I don't know if there's any other Linda Gottliebs. It'll come up. And if you want to learn more about the turning points for families, go to YouTube and Google Long Island Backstory Turning Point for Families, and you'll see another half-hour show that's all about the program. And this can be very, very helpful. Show it to your attorneys, show it to your healthcare professional, and spread the word. This is so important. I'm Gary Jacobs, and thank you for joining us on Long Island Backstory.